Anna Marie Sinatra from Sinatra Solutions. I'm an executive coach and host of Health Matters, where I am committed to bringing you quality programming under a variety of topics to bring you information so you take that information, turn it into power, especially in your time of need.
Hi, I'm Eva Sammarco, host of Health Focus. Not only am I the host of Health Focus, I'm also a nurse who is dedicated to bringing you the latest developments in health and also featuring various professionals in their specialized fields.
And together,
we bring you
Focus on Health Matters. But before we get started, let us thank our sponsors who make this program possible.
Western New York Imaging Associates, Dr. Frank Mascaro, providing state-of-the-art imaging equipment to assist you in your time of need. With many locations throughout Western New York, Kenton Open MRI, Lockport MRI, and Western New York MRI in the heart of downtown Buffalo.
And we want to also thank Joe DeMarco from Wings Flights of Hope. He's flying sick children and adults and their families for treatment all over the country for free. In transplant circumstances, a call might come in and the recipient must get there immediately, and Joe and his volunteer pilots stay on call to make sure that that child or adult get to where they need to be on time.
Bennett Health and Wellness, Dr. Matthew Bennett, medical doctor who also practices alternative and complementary therapies, from chelation therapy to herbal remedies and how food could help you stay healthy. Dr. Rapp passed her baton to Dr. Bennett to carry on her work.
So make sure that you get those pens and papers ready, because we're giving you lots of good information. You got to turn that information into power so you're making great choices for your life. And here we are once again at Western New York MRI with Dr. Frank Mascaro. Thank you once again for your continued support to this community by not only sponsoring this show to make sure that it happens, that we bring all this education to the community, but also your support with the cutting edge diagnostic imaging equipment that you make sure that Buffalo has, that Western New York has, the best that the world has to offer.
Thank you, Anne Marie. Eva, welcome back to Western New York MRI. We're glad to have you both here. Today we're going to talk about some exciting things. Our brand new 3 Tesla MRI. It is state of the art. It is fantastic. It's going to scan patients a lot quicker so they're more comfortable. It's a larger bore, meaning it's a larger opening so people don't feel claustrophobic. And we can do a few things that we don't need to use contrast with, and everybody's a little nervous about contrast all the time, so we could take that right off the table.
Wow.
For some imaging, absolutely.
That's awesome.
That's
We're
awesome.
excited to be here.
Yes.
Thank you.
Definitely.
It's always good to have you here, and getting out to the community and reaching out to all the people here in Western New York, especially in downtown Buffalo, but we're far reaching all the way to Lockport and into the South Towns and, Clarence and Lancaster also.
And we get lots of feedback. People are very grateful because you're educating them on what's possible in their time of crisis, and we really appreciate that.
Well, absolutely. I think knowledge is powerful for patients to know, because sometimes they're overwhelmed by, the possibility of some disease that can get them very anxious. So getting answers to patients and giving the diagnosis right away really calms them down. And, if it is something more serious, well, we can start treating it right away. That's the important part of being here at Western New York MRI and working with, our referring physicians and getting the best imaging for their patients and our patients also. So
awesome. Well, let's go see that brand new machine you just brought in.
Great.
Yes.
Well, Anne-Marie, Eva, right now we have a patient that is ready to go into our brand new 3 Tesla MRI. Our wonderful and very capable Wendy Thompson, our chief tech here at Western New York MRI, is caring for all our patients and taking good care of them. And as she gets rolled in, you'll see how wide the bore is and how comfortable the patient is. Very interesting. They slide right in, and you can see there's low level LED light, so there's some lighting in there that's not like a dark tunnel area. So it's very important to keep the patient very comfortable at this time, and it's a wonderful machine, and Toshiba's taken great care to make sure that the patient is comfortable, and the technology they've put into this machine is fantastic. Beautiful images at the quickest possible time that we can achieve them, and keeping the patient comfortable is also very important for us.
That's pretty awesome, and that is a much larger opening. I can testify to that.
Absolutely. It's the widest in the industry, and yet the images are spectacular. And that's very important, because to go through this and not get good images would be very unfortunate for the patient and all the time they have to spend to do this. And it's very important to get quality images.
Awesome.
Hi, Marie and Ava. Right now we're watching our chief technologist, Wendy Thompson, doing a MRI scan. And as you can see, the console where all the images are obtained and the protocols are set. But also there's a camera keeping an eye on the patient, where the technologist can keep an eye on the patient while they're inside the MRI. It's very important. Safety is very important to us and to the patient, and it's very important to keep an eye on the patient at all times while we're obtaining the scan.
And they have audio contact as well, right?
Absolutely. Absolutely. They have an emergency button to press if they need assistance right away. There is also audio contact with patients. We can listen as they talk, and they can hear us talk, as well as if everything is comfortable in there, they can also listen to music while they're getting their scan done. So we try to, again, comfort is very important to the patient as well as safety.
I remember that emergency button.
Yes, yes, Anne-Marie used the emergency button.
I did. I couldn't believe it, but I did.
Got a tickle in my throat. And here we are again, getting ready to talk about a brand new piece of imaging equipment. Today we have Dr. Joseph Serghany. He's the medical director of Kenton MRI, and also Dr. Krish Kartha. He is a neuroradiologist. Welcome, gentlemen.
Thank you. Thank you.
It's so nice to be here and talk to you both again.
Good to be here.
With a brand new
Yes.
imaging machine, imaging equipment machine. You guys are like always on top of everything with
Yes.
state-of-the-art, cutting edge, helping Western New York to stay healthy and diagnosing any issues that may come up for us.
We try to be.
Yeah, we appreciate that. So tell us about this brand new imaging equipment.
As you know, our commitment to Western New York and to Buffalo is unwavering, and our commitment to excellence in imaging is unwavering. And we have a full complement of imaging spread over multiple centers at Western New York Imaging Group. And what we liked was a cutting-edge 3 Tesla MRI, which we waited to get the best till the industry works its bugs out. And we were very lucky and fortunate to get the 3 Tesla Toshiba MRI that is the best in the market, especially in the fields and the users we're going to put it to.
Yeah, I did when Dr. Mascaro told us we would be talking about this today. I did my homework. I Googled it and found out how cutting edge and brand new it is, and all the benefits to the patients when they come. So we definitely want to talk about that so that people will know the differences, and that they're both good in their own way, but there's some really important factors we want to look at regarding this one.
This one is very complementary to our outstanding 1.5 Tesla Hitachi MRI. It adds things that complements the 1.5 Tesla technology. 1.5 does great things, and each one has its pros and cons, but you have to have both to have the most cutting edge. This is exceptionally good MRI when it comes to imaging the arteries, the great arteries of the body, which are the abdominal aorta, that takes the blood to the abdominal organs and then lower down into the legs. And it could do the imaging without injecting contrast, which is very, very unique. And the images come extremely reproducible and with very, very high quality that the vascular surgeons could depend on. And then you spare the patient the need to have a contrast injected in them that, sometimes could have adverse effects. So the lower you inject, the better. So unless you need to, I'm against injecting dye in patients.
Let's talk a little bit about that, because I know my own self have been very sensitive to chemicals and dyes and different things, and it's been an issue for me, so I'm really excited about this. So if you could give us some information, because I know it really matters with patients that have, we were talking earlier about diabetes and different things. Tell us a little bit about that.
Well, anytime you inject any kind of medication, there's always, you said you're sensitive to these things, there's always a chance of an allergic reaction. It's a low chance with this dye, but there's always that chance. But the other thing is, it can have adverse effects on people who don't have good kidney function, because it's the kidneys that are needed to clear the dye out after it's injected. So if the kidneys can't clear it out, it basically sticks around in the bloodstream and can have adverse reactions because you're not getting rid of it. So, most people with good renal function don't have that problems. But as Dr. Serghany was talking about, people who have problems with their arteries also tend to be the same kind of people who have problems with their kidneys. The same kind of risk factors like you were saying, diabetes, hypertension, those are the things that cause problems with your blood vessels. Those are the kind of conditions that cause problems with your kidneys.
Even cholesterol too, right?
High cholesterol, right.
Yeah.
Same thing, they both can. So since they have the same risk factors, people who tend to have problems with their arteries tend to have problems with their kidneys. So if you can study their arteries without having to inject dye, that can be very helpful in a lot of these patients.
And Dr. Mascaro earlier was talking something about the brain too. There's a distinction with this imaging equipment versus the 1.5.
Yeah, well, just to get at what the difference is between 1.5 and 3 Tesla, the Tesla part is basically a measure of strength of the magnet. So 3 Tesla just means it's twice as strong a magnet as the 1.5. How that helps us is, with that kind of strength of magnet, we can get more, basically more power in the magnet. You can get higher resolution pictures. In a lot of instances, 1.5 is plenty strong enough. But with the 3T, there are some things, particularly really high detailed images of the brain or the blood vessels in the brain we can get.
I can imagine how important that is. When we were at Kenton MRI, we sat with Dr. Serghany and he was showing us the screen and how you read it, and it was quite fascinating. So this must be really exciting to you when you're reading the results, to be able to see it so much clearer.
It is, as Dr. Kartha said, with neuroimaging, it adds a level, especially with earlier diagnosis of multiple sclerosis. For the most part, it's good. It's very fascinating, again, with the vascular imaging of the brain and the neck, head and neck. So we spoke about the abdominal aorta and the runoff, which is the vessels or the arteries to the lower extremities or the legs. But also it is extremely good for imaging the vessels of the neck, patients that tend to have strokes, as well as the brain, where you could look for aneurysms or atherosclerotic disease or vascular disease. The 1.5 Tesla always comes a little handier when you have patients with a lot of metal in them, if they have had stents. So as Dr. Kartha said, the magnetic field is twice as strong, which means also some of the
You suck people with a lot of metal in them right into the machine, the 3-point.
so it's good
you
to
use
have
the lower one.
It's good to have the balance, and when you have the power when you need it, and you have you have the resolution with both equipments. It's also exceptional in breast MRI,
Ah.
which also our 1.5 is exceptionally good in 1.5. So as you see, we always want to make sure we give the patient all the choices. We have at their disposal everything they need, whether it's a 1.5 or a 3 Tesla, and just make sure that within our centers we can fulfill all the needs of our patients.
And you know, we really appreciate that. I appreciate what you said in the beginning, your unwavering support, because that's really what it's been. Western New York Imaging Associates have been with Health Matters and Health Focus since its conception. And we really appreciate it because we're able to bring information and education to the community so that they know, so that when they go to the doctors, they can ask, they can say, well, gee, I heard about this and it's here, and they can ask questions, and they can ask and say, this is where I want to go, and or this is what I want to take, this is the doctor I want to see, this is the specialist I want to go to. And that's what this program is all about, empowering people. And really appreciate that you're so committed to the community of bringing, you know, to Western New York state-of-the-art imaging equipment, because you know, you don't know how much you're going to appreciate it till you're in a crisis, you know, unfortunately.
It's true. I do have one question now. A person with multiple sclerosis, you can actually see like the decay in the brain of the white matter through this not through this imaging?
Yes, you could see it with MRI. You could see the plaques that develop around the white matter tracts in multiple sclerosis.
That's fascinating, though, just to see that. I mean, to pick that up, you know. Years ago, they couldn't diagnose something like that.
And MRI will find these long before a CAT scan. Well, so that's a major difference. You can have a very normal CAT scan and a very abnormal MRI in multiple
Really?
sclerosis.
Yep.
So if someone's experiencing symptoms and they're going down the list of things to do, when you get to this, you would be able to diagnose it much quicker.
Yes.
Even with like Alzheimer's, too?
Alzheimer's is still,
Yeah.
you know, when you're doing the scan, it's at this point, it's usually more to make sure there's nothing else going on.
I see.
Yeah, I think we still need more research on the Alzheimer's, hopefully. I know you guys will have the information for us as soon as it comes out. One of the things that also when I was doing my homework, Google 3 Tesla MRI, found out that it's a much larger opening too. Because much to my surprise, I'm like that hair commercial, and I'm a patient too, I'm a client too. I remember once I had to come for imaging, and they're like, do you have any problems with, you know, going? And I was like, oh no. And all of a sudden I was in this little tube, I was like, okay, stop. Because she said, just you could say stop anytime and then they hear you. And that's when I went to go see Dr. Serghany at Kenton open MRI, because it's wide open. But yet this one is still, kind of sounds like it might be like in the middle of a regular MRI and then the open one.
You know, what's amazing is that usually the higher the strength of the Tesla of the magnetic field, to keep homogeneity and because of the technology and the physics, usually the bore should be smaller. So it's more difficult technologically. It's a big challenge for the developers of those equipment to make them with a larger bore, and this comes with the largest bore, the widest bore in the industry, which makes the experience for the patient the better.
Yeah.
You know that firsthand.
Yes.
Yes, I do.
Yeah. And it's a shorter scan time. Oh, I'm sorry.
Yeah,
Yeah.
what I was going to say too, the larger, it's good for, I think you called it bariatric.
Bariatric,
Bariatric
yes.
patients as well too, so larger size people don't have to worry about getting in this tiny little skinny hole
And
anymore.
as you just pointed out, it can be a faster scan time too, because the higher strength magnet can do two things for you. It can give you higher resolution pictures, or it can give you the same resolution faster. So in some patients, that's more important, actually, is try and get the scan done faster.
And how would you say how the importance level is when you're doing children?
Yes.
Yeah, children, if assuming they can stay still for it, faster the better.
Yeah, that was in my homework too. It said it really works out well when you have children. You don't have to sedate them because you could do it in a much quicker time too.
Right.
So.
All the way around, it sounds fantastic. especially with the claustrophobia, because I don't like to be closed in either. Like
Oh, you
that.
too?
No, not like that.
Ah,
I mean,
I'm
when
not
it's real
alone in
tight.
this.
No, you're not. Because then, you feel like the walls are coming in on you. When it's like this, you can relax better, and it'll go faster too, without that.
And it's really
without that.
nice too, because you have the headphones on and the
Mhm.
person is talking to you through the whole
Yes.
time, and you can stop it at any point you want.
Yeah, the technologists engage you, and typically an MRI study is not a continuous 30 minutes or 15 or 40 minutes of imaging. They acquire a set of images, then there is a gap during which the technologist will talk to you, and that will guide you. So that will kind of make the time feel like it's going a little faster.
Mhm.
It's pretty awesome. So what else? What else? What other haven't we hit yet, so that people are aware that this is here and what's going on in their life, that people who are watching today might say, well, gee, how would I know? What questions should I ask my doctor? Because being proactive when you go to the doctor is really important. Not just listening. One doctor says one thing and boom, you're getting information with the internet age now. People are Googling to find out, to learn more. So what's going on that they can know if this is something they might want to talk to their doctors about?
Well, as Joe said, most our 1.5 is really pretty adequate for most things. Things where you might consider changing over, as we were saying, there are scans of your arteries that if we did on 1.5, we have to inject contrast. So, the 3T we can usually get away without doing that. So that's a big plus. You think of any other?
Yeah, we basically hit on the major differentiating what's this MRI is most powerful at that other 3 Tesla MRIs cannot do as good as that, and 1.5 Tesla MRIs cannot do. But not to forget that, if you have a knee injury, meniscus injury, hip injury, osteoarthritis, osteonecrosis of the hip, lumbar spine, spine injury, neck injuries, abdominal imaging, solid tumors of the abdomen, which are tumors of the liver, of the kidneys, of the pancreas. It's a phenomenal magnet.
Partly the rapid scan time comes in handy and helps with the abdominal imaging. A lot of the abdominal imaging has to be done with holding your breath, because everything moves when you breathe. Because this is you can scan more rapidly with this. We get really beautiful abdominal imaging.
Oh.
And typically for abdominal imaging, the 1.5 Tesla is usually a little superior, because there is some dielectric, which is a technical name for an artifact that happens that Toshiba has addressed, so they don't have the artifact, but they have the strength, as Dr. Kartha said, so you could do it in shorter imaging time. So if you can image with a patient holding their breath, which we call breath hold
Right.
sequences, the images come crisply, especially if you're looking at the bile ducts, the gallbladder, etc. It's fantastic.
So it doesn't sound like there's anything that is left out. Everything can be scanned,
Everything
either
can-
with the 1.5 or the 3, depending on what's going on. Your doctor may tell you, uh-oh, we got a little issue here. You need an MRI.
Right.
You can ask some questions and then learn about which is the best for you.
And as Joe touched on, the one place where they might say don't do the 3T is if you have metal implanted.
Yeah.
And not
That's
even
what I
so
thought.
much for the safety standpoint, but because the magnet is stronger, metal interferes with it more. You get more
Right,
artifact
right.
with the 3T than you do with 1.5. There's also, people who do have implants, stents, whatever, there's a long list that have been tested at 1.5. They're all going back and retesting them at 3T to make sure they're safe.
Oh,
Yeah.
how nice.
Yeah.
Wow.
Very nice.
Modern science, modern
Modern
medicine.
technology,
We just really
too.
appreciate you,
Yes.
taking the time out to
Oh, thank you
help to
for-
educate the community, so they've got the information, then the information is power in their own lives. We really appreciate that.
Yeah.
Thank you.
Oh, thank you for
Thank
talking
you.
to us.
Wasn't that an awesome show?
Awesome. I learned a lot today, didn't you?
Yeah, I did.
Yeah.
I learned that you're claustrophobic too.
Yes, I am. Let me out.
I know. I hated to admit it, but I did. I used
Yeah.
that button last time I was here. She was like,
Oh,
"There's a
you
button."
did?
If you need it. And all of a sudden, I was going and it was like,
It
"Beep."
feels like, your life, saves your life. Get me out. But the open MRIs are great.
I know,
aren't they?
this is amazing. I'm so grateful for all this brand new technology.
Yes, yes.
Yeah, because you never know.
You never know when you might need it.
Yeah, unfortunately. But
Yeah.
thank God there's places around where we can
Yes.
go to get the help that we need.
Yes,
And
definitely.
speaking of the help, we got more sponsors to thank for making this program possible. We want to thank Mr. Frank's Day Spa, where Kim Will is the owner and the head stylist.
Oh,
and
Day
she's
Spa sounds
yeah,
wonderful
I know.
right now.
Maybe we should go there right
Yes.
now after here.
Yes.
She's committed to teaching people how to take care of their hair and their nails. They do medical manicures, and while they do that too, pedicures. While they do that, they put you in this chair
do?
that vibrates, and you soak your feet.
Are you
and-
serious? Do they have
yeah.
headphones?
No, but maybe we should tell her
should
to
tell
do
them
that. And you've got one too.
Yes, I do. The Healing Spa with Marge Reed. She offers holistic, non-surgical facelifts,
How am I
facials.
looking?
Yeah, you're looking great. Balancing color and light therapy and many other therapies to help bring the body into balance wherever it is needed. Holistic. That's one of my favorites.
Yeah,
you know.
yeah, yeah. Me too.
Oh,
Always learning about holistic
Holistic
stuff.
stuff.
And M2 Metabolic Method, the ultimate weight loss plan. They're an awesome new company, and they provide one-on-one coaching available to help everybody reach their weight
weight
loss
loss.
goals.
Wow.
Something I've been struggling on and off my
Yes,
whole
me too.
life. So we hope that you enjoyed the show. We hope that you took lots of good notes.
Yes,
And if
remember-
you're someone watching the program, especially holistic people, we want you to give us a call or email us, because we'd love to interview and have you on
yes.
Focus, because
Your health matters.